The Rota Health Center is fully operational after Typhoon Mawar, and its 40 staff continue their jobs as recovery is ongoing.
In facilities-wise, we have a lot of mitigation issues that we have to take care of for the next typhoon, that we're probably going to be experiencing, so we need to be prepared for that.
Lessons learned in this response, with issues reaching back to 2018 after Typhoon Mangkhut hit Rota, including fixing their health center's only generator and trying to get a second one on the island from Saipan amid shipping issues due to weather.
The urgency is there, and that's why the CEO is pushing all the efforts as possible to mitigate this situation.
The NMI's only hospital also shifting its effort to help the Guam Memorial Hospital and Guam Regional Medical City.
We did ship some supplies. We did ship some albuterol nebules, and we also are shipping some monitors, vital sign monitors, BP monitors, pulse oximeter. Those are items that we actually have in stock to share already. So especially when you're doing an outreach and with post-typhoon, there's a need to check how well the patients are, or the people out there, in shelters. And so, we are willing to help when we can.
She says the Saipan Hospital is ready to send a team of healthcare professionals when Guam Governor Lulian Guerrero activates the Emergency Management Assistance Compact, which all 50 states and territories signed on to provide mutual aid.
In a way, is important to activate because it does, ease the burden of any jurisdiction that's helping out. So, when we're talking about, let's say, for example, nurses, who pays for those nurses when they're going, right? So the EMAC agreement is something that basically is there.
The EMAC's website says the compact allows governments to share their resources with one another during emergencies, give and receive reimbursement for shared resources, and give and receive liability protection for their officers and employees rendering aid.
So in the meantime, we provide resources that we can. We're outside the EMAC, and those resources are something like I said, we've had an agreement before especially with GMHA. Whenever there's a need, whenever we need anything, sometimes the shipping is an issue, right? I mean, we live in a geographical location where sometimes supplies don't come on time. So what you do is you try to work together.
The Guam Governor's Office said the process to activate EMAC is underway. Crystal Paco San Agustin told KUAM, quote, "We want to ensure it goes through the EMAC process so CNMI may be properly reimbursed and personnel are covered by the same protections offered to current GMH employees." Thomas Manglona, KUAM News, Saipan.